Good morning, good morning, good morning, and welcome to the Great Lakes Health Radio program here on Power 96.5 FM, WUFO 1080 AM, and there might be some of you who might be listening through Google. My name is Francesca Messiah. I'm your host for the program from Kaleida Health. And you may wonder, and I know I say this every week, but it's always that question, who is Kaleida Health? We are a hospital system. We are Buffalo General Medical Center, Oishei Children's Hospital, Gates Vascular Institute, Millard Fillmore Suburban Hospital, Visiting Nursing Association, also commonly known as VNA, DeGraff Medical Facilities. We have adult clinics. We have an adult clinic at Hurdle, called the Hurdle Elmwood Clinic. And then we have a children's clinic. We have one on Niagara Street. We also have one on Broadway Avenue, and that is the children's pediatric site. We have women's health clinics. We have two. We have one on Niagara Street, and we also have one on Kensington Avenue where the bus stops right in front of it, and that's housed on the ECMC campus. We also have two long-term care facilities, one at DeGraff as well as one called High Point. And High Point is at the corner of Michigan and High Street. Kaleida Health is available for outreach, speaking engagements, both in person and virtual. Next month, Kaleida will be one of the sponsors for the Buffalo Marathon. And if you're interested in learning more about that, I suggest just Google Buffalo Marathon. If you're like me, you Google a lot of things. Well, this is April. April is Autism Awareness Month. And I would say just about all of our listeners have heard, either you might have a child with autism spectrum, or you may have heard that, you may have seen something on the news, or again, you may have a child, a grandchild, a foster child who's been diagnosed with autism spectrum. And that is our topic for today. And today, our guest, we have Dr. Michelle Hartley McAndrew. Hello, Dr. McAndrew. How are you?
Hello, I'm good. Thank you so much for having me today.
Oh, you're welcome. I am excited about this topic. And and Dr. McAndrew is the interim division chief for developmental pediatrics and rehabilitation. She also wears the title of medical director of the Robert Warner Center. She also wears the title of medical director of Children's Guild Foundation Autism Spectrum Disorder Center, and the final title here is that she wears is Clinical Associate Professor of Pediatrics, and that's at the UB Medical School. Dr. McAndrew, you are a busy person. Yes. So let's just start the conversation. And I'm just going to begin with a few questions. What is autism? And is autism the same as autism spectrum disorder? And how early are children diagnosed with autism?
Yes, so autism, the term autism is often used interchangeably with autism spectrum disorder. So back under the DSM-4, which is the Diagnostic and Statistical Manual of Mental Health Disorder, the fourth revision or edition had separate diagnoses of autism, Asperger disorder, and pervasive developmental disorder. Then in 2013, that was actually revised to the fifth edition, where the diagnoses of Asperger disorder and pervasive developmental disorder were no longer used, but it included a wider array of presentations, and it all came under the umbrella of autism spectrum disorder. So usually we use autism spectrum disorder, but people still accept autism as a term as well. And your third question, how early is autism diagnosed? So An experienced professional can usually diagnose autism reliably in as early as 24 months. Sometimes it can be a little bit earlier, depending on the child, perhaps as early as 20 months. But the important thing to understand about autism is that it is a neurodevelopmental disorder that affects how a child learns. So, very much like a learning disability, where teachers and therapists require a different approach to help the children learn. So, it's a different way that they understand the world around them and they interact with their environment. And that's a really important distinction. It's not just a behavioral disorder, but it's actually neurodevelopmental, where there are, in fact, differences in how their brains are wired and how they're making sense of things that are happening around them.
Mm-hmm. Now, who makes the diagnosis? Is it the pediatrician, or is it with the pediatrician sending the caring adult, the parent, grandparent, foster parent to a specialist? Like, so who determines autism?
So autism spectrum disorder is a clinical diagnosis. So usually either a physician or a psychologist in New York State can give the diagnosis. A lot of times there are certain measures that are required by various, state agencies and organizations that are needed in order to substantiate the diagnosis. So, for example, there are certain rating scales and our testing measures like the ADOS are sometimes needed in order to accurately document the diagnosis. But it is a clinical diagnosis, meaning there's no one blood test or imaging study that we can give.
Mm-hmm. How would a parent even know, or I should say, does a parent or the grandparent, the person responsible for the child, is it something that they would notice in the child, or is it something that the physician notices? Like, I've heard people say that their child isn't speaking and they were diagnosed. So I don't know, like, how would someone even know that their child may have the autism spectrum disorder?
Yeah, so a lot of times it's not an easy diagnosis to determine. That's why it does take a tremendous amount of work for each child to give the diagnosis, because there are many children with who just have language or developmental delays, but there is a difference when there is an autism spectrum disorder. So it wouldn't necessarily be something that a parent would necessarily be able to determine, but some of the the red flags that they should request from their pediatrician or family doctor for an evaluation is loss of previously acquired speech, babbling, or social skills, if there's any avoidance of eye contact, any persistent preference for solitude, difficulty understanding people's feelings, delayed language development, persistent repetition of words or phrases. We call that echolalia. Any resistance to minor changes in routines or surroundings, restricted range of interests, repetitive behaviors, such as flapping their hands or spinning, any unusual or intense reactions to sounds, smells, tastes, textures, lights, or colors. So the pediatrician usually, according to the American Academy of Pediatrics, they recommend developmental surveillance, but they also recommend screening measures at their well child visits. And then there's autism specific screening measures that should be happening at 18, 24, or 30 months. So they should be doing actual screening measures, meaning questionnaires, that should be occurring at the pediatric well visits. And those screening measures, whenever there's whenever we have a screening measure, means that there could be, false positives in there, meaning that it picks up a lot of, a lot of features, but it doesn't necessarily give the diagnosis, because, other things can cause that too. So then, they would recommend coming for further evaluation.
So is there an autism spectrum disorder office? And if so, where is it located?
So there is at the Oshai Children's Outpatient Center. We have our Robert Warner Center and our Children's Guild Foundation Autism Spectrum Disorder Center, where we see children and do evaluations. And we also help support families who have a child with this diagnosis. So we see children up until 21 years old. And we do have different teams of providers giving these assessments. But yes, that's at 1001 Main Street in the second floor at the Oshai Children's Hospital Outpatient Center, right downtown.
Yeah, and that's at the corner of Main and High, just in case. And it's the Allen Street subway stop. So just in case people weren't familiar with the area, just trying to give them a little bit of logistics. So then, how soon after receiving an autism spectrum diagnosis should the parent, grandparent, or caring adult make an appointment? And who do they make to make? They would make the appointment with your office. Is that how that works? At once a child was diagnosed.
So yes. So we often, after we make the diagnosis, we have the family come back and we share with them a tremendous amount of information, regarding supports in the community, the approach, helping them understand how their child thinks about things, how they're understanding. And then we try to follow them, like I said, at least, every year, every couple of years, more frequently, certainly if they're, having more issues or difficulties, we'll see them back more often, depending on the child.
Mm-hmm. And then are the appointments in person or are they virtual?
They're usually in person.
Mm-hmm. And is there a certain age that it's normally detected that autism spectrum is normally? Well, you did say that the younger age, but I should ask the question then: what happens if it gets misdiagnosed, or does anything happen if it gets misdiagnosed? Because I'm sure maybe someone hasn't been to the doctors and the child's been living, with this, with autism spectrum for a few years. Is there, what happens if it's missed? I mean, is it then just later caught, or if you could explain that?
So every child on the spectrum is very different. They have different strengths, different challenges. Not all children with autism show all the signs of autism, and many children who don't have autism have a few. So that makes things a little bit more challenging. So if children have more disruptive behaviors, meaning they're just having a lot more difficulty. They might be having some more tantrums or things like that. Sometimes those are called to our attention a little bit sooner. But if children are, they have language and they're a little bit more, quiet in their demeanor, they might go a little farther in their school journey before they, anybody maybe considers that could be a possibility. A lot of times, there might be children who are having difficulty with some social interactions, and they might be mislabeled as something else. And so, sometimes those might take a little bit of time to really get to the underlying issue, which could be an autism spectrum disorder. We do like to identify these children very early because, as I mentioned before, it is almost like similar to the way a child with a learning disability might need a whole different approach. Because we know that children on the spectrum understand things a lot easier visually than auditorily, meaning that they might be able to understand something they see a lot easier than when it's spoken. And so, if you have a parent or a teacher who thinks they're just ignoring you and maybe yells a little louder, that's not going to help that child. So, really helping the teachers and the therapists understand that they can process language, but it might take them a little bit longer to process. And so they might need, some more visual supports. They might need fewer words. They might need you to repeat what you've asked because they might have only caught the last part of what you said. So things like that, the teachers and the therapists, it would help them to understand that this child isn't just ignoring, isn't just, engaging in some challenging behaviors. They're just being themselves, and it's not, really, parents and teachers and therapists, not to take it personally, but that, the child might truly have some challenges there.
Yeah, and that's so important. And just a real quick question. Do you know the way a medical student is trained in next steps if they, you talked about a screening tool. Do you know, and it might be a conversation for an educator, do you know if teachers are also trained in this? So in terms of so that student isn't misdiagnosed or sent to the detention room or sent home. I mean, I'm just curious if educators, someone studying to be a teacher, let's say elementary school teacher, are trained to recognize autism. Are you aware?
That's a really good question. I don't know how special education teachers are trained. I don't know how much autism specific training they get. I know that autism is becoming more prevalent with the most recent CDC rates at 1 in 36. Now, 1 in 6 children has a developmental disability. So it is very prevalent, but 1 in 36 children. So I don't know how much autism specific training they get. I think that more and more of the smaller classrooms, I think it would be, very helpful, to be equipped with, some of the strategies and tools to address these children.
Is this something autism spectrum with, saying it's been detected at an early age at 2. Is it something by the time that the child graduates from high school that it can be corrected, or for lack of a better word, I'm probably not using the correct clinical term.
Yeah, so once a child has a diagnosis of autism spectrum disorder, many children still display some symptoms as they get older, although they may learn how to compensate for some of the things that might not be coming as naturally for them, depending on how they respond to some of the therapies and so, like I said, every child is different, and how they, continue to display autism signs and symptoms. But certainly, our whole goal is to work with the child very early so that they can meet their ultimate potential and, functionality as they continue to grow.
Okay. Yeah. Yes. No. Because there's so many movies that touch on it, and I was just wondering, if it's something that, but like, that you outgrew. But it sounds like when treated early, there are things that can be done to assist the child, which really, bottom line, assists the family. Are there family supports that are part of the autism spectrum disorder program at Oshai Children's Hospital?
So we give families a lot of information about community supports. We don't have a specific parent group affiliated with our center any longer, but there is support groups out there for parents, because and we highly recommend it. Not necessarily that they need other people to hold them up, but maybe as a source of information because if they're having a certain experience, it's nice to, have a parent next to you that has had a similar experience and have a place to share information. A lot of times parents will feel very isolated when they have a child with a different learning style. And so, they might feel, well, my child just isn't catching on to X, Y, or Z. And, they might share it with some of their friends. And if they have children who are more typically developing, they wouldn't, and so it can be very isolating for them. And so if they have a group of parents that are living that shared experience, they can talk to each other and say, yep, I've been there. This is what I've done. This is, this worked for, you can try here, or you can go there, or, check out this website, or it's just a really nice, it's a nice support for families. So we really encourage that.
Yeah, that's great. I just remember a few years ago, I don't know, I was listening to something or reading something, and they talked about sometimes movie theaters. Like they'll say, yeah, they'll say, something, for children with autism or adults with autism spectrum, and the movies aren't as loud or not as dark. Am I correct in those things that I've read about with movie theaters?
Mm-hmm. Yeah. So some of the theaters would have like sensory friendly nights. So there's different programs that will work with some of the community businesses that help promote those more awareness, especially during, April Autism Awareness Month, where, just different businesses can have sensory friendly nights where, families with children with autism can go and like you mentioned, the lights might be on, or the sound might not be too loud, that kind of thing. Um, so definitely.
Yeah. How would someone reach you or your office if they had more questions? Do you have a phone number or email address?
So our phone number for the center is 716-323-6560. And that's specifically for the Autism Center. For the Robert Werner Center, it's 716-323-6410. So certainly, even if a lot of times that the pediatrician feels that there might be some developmental delays, or there might be some concern for autism, we will definitely have the child evaluated. There's a number of different clinics within the Robert Werner Center and the Children's Guild Foundation Autism Spectrum Disorder Center. We have our intake clinic and follow-up clinics and that kind of thing. So we'll get you directed to the appropriate clinic.
And Dr. McAndrew, I have more questions, but I'm getting the flag that I know that we have to end it soon. So I just might bring you back. Not I might, but I'm thinking about maybe having you back in around August, September, as children are getting ready to get and are enrolling in school, and you have new parents, new grandparents, enrolling the children, just to make sure that they hear of this program again, because this information to me is just so important in the developmental growth of a child, and keeping the family together, not to go to pieces in case their child is diagnosed with autism spectrum disorder. So I want to thank you, Dr. Michelle Hartley McAndrew, for being our guest this morning on the Great Lakes radio program and taking time from your busy morning. So I want to thank you so much.
Oh, it's my pleasure. Thank you so much for having me.
Oh, you're welcome. And listeners, I just want you to know that April is Autism Awareness Month, and but we're going to also have Dr. McAndrew back again in a few months, closer to the beginning of the school year. And I just want to thank you for listening today to the Great Lakes Health radio program. And next week you will hear Cindy Bass, my esteemed colleague from Erie County Medical Center. And I just want you to be safe. Just be safe. And God be willing, you will hear me again in 2 weeks. Take care. Bye-bye.